Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Morning, everyone.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Morning, everyone. So, we are continuing our kidney week, and today we're going to talk about staging of kidney disease. And there's reasons that we want to know what stage of disease they are in. I followed it loosely in practice because I was generally looking at things from a more holistic standpoint, which is pretty different from the traditional standpoint when it comes to treatment of this disease. So I did not use this as much as a lot of veterinarians will. And for some people, this becomes an absolute, and I'm a firm believer that there are no absolutes, and every animal is an individual, and there are going to be exceptions to every rule. So, but chronic kidney disease is diagnosed based on evaluation of all available clinical and diagnostic information in a stable patient. So, I mentioned yesterday that we don't want to take one lab value and make our diagnosis and make our staging based on one lab value. We have to use a lot of different parameters to really decide where we are with our patient and where we need to go with that patient. So the staging is classified based on parameters set by IRIS, which is the International Renal Interest Society. So they're the ones who lay out the parameters for the staging of the kidney disease, and then they also lay out treatment recommendations based on those stages. And like I said, holistic veterinarians a lot of times will treat things a little bit differently, especially with diet recommendations, than traditional veterinarians will. So they recommend mostly using, they recommend using serum creatinine or SDMA, which is really weird because they say, well, we're going to use a lot of parameters, and then they say use one or the other based on assessment of, and then also blood pressure and protein in the urine. So we're going to talk about all the different things because they really all come into play. And by the end of the day today, we should have a download available for you where you can print these out and have this information available to you. Basically an outline of what we've been talking about this week and a lot of information and tables for you. So there are 4 stages of chronic kidney disease that we talk about in our dogs and cats. And so I'm going to run through them, and then tomorrow we're going to talk about the different things that we do for treatment, and we'll talk more about how they play in based on stage that the animal is in. That will help determine where we are in those treatment parameters. But tomorrow we're also going to talk about not just the traditional treatment recommendations, but also supplements and some alternative things that we would recommend from a holistic standpoint. Okay, so stage 1 is defined in I'll do dogs and cats. Stage 1 is defined in dogs as having an SDMA, which is elevated, so normal. Remember, this is that specific IDEX test. A normal is up to 14. So if your animal comes back with an SDMA of 14 to 17, they're going to say that they are in stage 1, and that's for dogs and cats. They'll still have a normal creatinine, and it's a normal or mild increase in the SDMA. So it's really interesting. Your animal could have just been a little dehydrated when they went to the vet that day. Maybe they didn't, maybe you withheld food and water overnight before you took them in, but they can get a stage 1 kidney disease diagnosis based on the fact that their SDMA was ever so slightly elevated. And so I do a lot of consultations for people who call me and say that, hey, my animal just got diagnosed in kidney failure, and I look at their values and say, well, yeah, the SDMA came at 15, but look, everything else is 100% normal. That's not a kidney failure diagnosis. So I don't like this test that much in those low levels. I mean, certainly when it's very elevated, it's very significant. But in those beginning stages, where the SDMA might come in at 15 or 16, I think that we are sentencing a lot of animals to a diagnosis of kidney failure, and a lot of pet parents to a lot of anxiety when we don't have a clear picture that there really is something going on. So what they do say is there should some other kidney abnormality also needs to be present. And unfortunately, a lot of veterinarians don't grab onto that. They just look at the SDMA and make a diagnosis based on that one piece of information. And that's why I'll keep saying we need multiple pieces of information, not one. If you have that elevated SDMA, that slight elevation, the 15 to 17, it also needs to be accompanied by inadequate urine concentrating ability, so a dilute urine, or something on palpation where we're feeling pitted kidneys or small kidneys, and we haven't identified something else going on that could be causing acute kidney failure, like leptospirosis, Lyme disease, FIV, FeLuc, toxin ingestion. So we need to be seeing either that dilute urine or some protein in the urine, and maybe we're seeing changes in the creatinine, but generally in stage 1 the creatinine will still be normal. And it needs to be a persistently elevated SDMA. So if you go in and you have a single blood test done and the SDMA comes in at, let's say, 16, everything else looks good, then the recommendation is take your pet back in, make sure they are extremely well hydrated, give them some bone broth, something good to drink, make sure they're really well hydrated, get that blood test done again. And that blood test may now be back down to 13 or 14, which is in the normal range, and poof, your animal is no longer in kidney failure. So we have to use either multiple parameters, or we've got to indicate that the SDMA is persistently elevated. It's not a one-time deal. So that's stage 1. We're going to talk about some other parameters that go in with this as well. So stage 2, for dogs, the SDMA is between 18 and 35. For cats, it's only 18 to 25, and they're already considered stage 2. And I'll just give you a quick tip about treatment for tomorrow. We do not recommend protein restriction in stage 1 and stage 2. So we don't want to be, this is where I get upset when I see these veterinarians saying, oh my gosh, your SDMA is 15, your dog needs to be on prescription kidney diet, or your cat needs to be on prescription kidney kibble. And that is so wrong. Absolutely wrong to be holding protein back from these animals. This is why we get muscle wasting, they get skinny, they get very weak. It's wrong to withhold protein at this point, stage 1 or stage 2. So at this point, they may or may not be starting to show some increases in creatinine. And we should be seeing some changes in the urinalysis, whether it's a dilute urine or some protein in the urine. There's got to be some other things that are starting to happen. Stage 3, based on the SDMA, the dogs 36 to 54 and cats 26 to 38, so it's much lower in kitty cats. It's a more sensitive test in them. And at this point, they're probably going to have elevations. They definitely would have elevations in their BUN, elevations in their creatinine, and also changes in the urinalysis. Stage 4, based on the SDMA, is dogs greater than 54 and cats greater than 38. And at that stage, we are definitely making dietary changes, treatment changes, fluids. We're getting into some pretty critical situations when they hit the stage 4. All right, so let's look at, staging by proteinuria, which is how much protein is in the urine. So they like to use the UPC, the urine protein creatinine ratio, that I couldn't think of yesterday. That's what they like to do. They said you could do an microalbumin, but the UPC I think is a better test, and that's what they recommend. So, and this is interesting, the parameters are different on this one as well. So for a normal animal, the UPC is going to be less than 0.2. Borderline, having a protein problem in the urine for dogs is 0.2 to 0.5, and cats is 0.2 to 0.4. And interestingly, in clinical practice with dogs, anything 0.5 or less we would consider is doing just fine. And then protein spilling in the urine. So when you get your urinalysis or you do a urine dipstick, it'll give you protein. It'll say trace 1+, 2+, 3+, 4+. But you could have 4+ protein reading on that, which could be a false positive if you've got a urinary tract infection, if there's red blood cells, white blood cells, bacteria, contamination of the urine. So that's why we can't just go with, oh, he's got a 4+ protein, that means he's spilling protein in his urine, his kidneys aren't working. That's not correct. We have to do this UPC because that just the protein reading could be a contaminant and could be a false reading. Okay. Let's see. So, all right. And then there's substaging by blood pressure, because remember we said we have to check blood pressure in these animals, and the higher the blood pressure, the more chances of kidney damage being done. So a normal systolic blood pressure in dogs and cats is less than 140. Blood pressure can be difficult to measure in our animals because if they've just gone through a car ride, a cat in a box, they're being handled by strangers, there might be barking dogs and strange smells in the veterinary clinic, they may be very freaked out. So getting a good reading on blood pressure can sometimes be a bit problematic. But anything less than 140 is considered normal, and there's minimal damage risk for the kidneys. From 140 to 159, they're considered pre-hypertensive, and there's low risk of organ damage. From 160 to 179, that is considered hypertensive, and there's moderate risk of damage to the kidneys. And greater than 180 is considered severely hypertensive and high risk of damage to the kidneys. So we definitely would want to add, whether we're using herbs or food or medications, to lower that blood pressure if they're over 160. We want to keep them lower so that we're not risking damage to the kidneys. And it is recommended, they're recommending that we're monitoring the blood pressure over a period of 1 to 2 weeks and not just use a single reading. Because again, it could change based on how stressed they are that day in the clinic, depending on who's having a good day or a bad day. Okay, I thought there was one where they talked about the creatinine levels as well, but for some reason I'm not seeing it. So a normal creatinine is going to depend on the lab being used. They're not all the same. All right, let's see. All right, that's all recommendations for treatment. So it's going to depend. Cats' normal creatinine is a little bit higher than in dogs, but generally we're looking for things below 1.7-ish, depending on the lab. Some labs will even say a 2.0 can be normal. I think that's a little bit high. But in the animals in stage 1, the creatinine is going to be normal. In stage 2, it may be very mildly elevated up to a 2, 2.1, 2.2, something like that. Stage 3, I think the creatinine goes up to 5. And then after 5, we're considered stage 4. What I don't like about all of this, and I don't like saying that an animal is in kidney failure, because I think when we hear the word failure, it automatically takes us to that mindset of, oh my gosh, he's dying, this is it, it's all over. And I have had animals come to me in stage 4 kidney disease. One little dog in particular, a little Cavachon, cute little dog, was diagnosed 4th of July weekend with stage 4 kidney disease, and the owner was told to put him to sleep right then and there. Had all the symptoms. His BUN was over 200, his creatinine was 13 at the time, and there was no SDMA. This was before the days of SDMA. And so, 4th of July weekend, the owner is distraught. She's got a vomiting dog who's dehydrated and horrible lab values. I mean, we can all agree those are horrible lab values. She found me and saw me a week later. Managed to keep the dog alive. She also went back to her regular veterinarian on Monday, who also said put the dog to sleep, but gave the dog some fluids. Came to me within that week, and I said, well, yeah, these are terrible lab values. And from a traditional medicine standpoint, I would say we don't have a lot we can do here other than fluids. This is terrible. I don't know how long we have, but let's try some things. And we literally threw everything we could at that little dog as far as acupuncture, herbs, dietary changes, fluids, all kinds of things. And he got another 12 months. 12 very high quality months. And I saw him pretty much every couple of weeks during that time period. His lab values never even approached normal. His lab values were always pretty horrible. But he was playful, active, happy, and had a good year. The interesting thing was when he finally did pass, the owner called me distraught, absolutely distraught. And she said, it was so sudden. And I had to remind her that we had 12 really good months. It was not sudden. And, but to her, it was sudden because for those 12 months, he, we had bad days and good days, but he had a great quality of life, and it was, it was a game changer. It gave them 12 months, but when the dog finally did go, it did seem very sudden to her because, one day he's running around and the next day he's not. So, but I don't like, I don't like gloom and doom. I do like being realistic about the prognosis for these dogs. Monkey's House, they had Parker, who was a pit bull, came to them with just horrible kidney disease. Not quite as bad as my little dog, but he was given a few days to live as well and lived 9 very high quality months at Monkey's House. So you don't have to give up on day 1. There are things that you can try. Holistic veterinarians look at this a lot differently from traditional veterinarians, and we do have a lot of success with these guys. Not all of them, but a lot of success. So it's good to know the staging because it is going to affect how we're going to treat things, and we'll talk about that tomorrow. And then Friday we'll talk more about diet. We'll have some recipes for you and get into some other things. At least I think that's what we're doing Friday. We're not 100% sure. And for supporters, Friday night I will do TCVM, kidney disease, so we'll look at it from the Chinese medicine perspective, which just gives us a little bit different take on things. Okay, everybody have a wonderful day. I gotta go get, I don't know, crap ton of work done. This retirement gig is not so relaxing.